Now stay tuned to the following radio broadcast.
You're listening to the Victory Station, AM 1360. We're glad you chose us. Thank you.
It's Impact with the Florida Star, the largest, oldest, and most read African-American newspaper in Northeast Florida and South Georgia. And now, here's the host, the publisher of the award-winning Florida Star, Clara McLaughlin.
This is Opio, and welcome to another episode of Impact. We're going to be talking about a very, very important topic today. And solutions. Prostate cancer. We never know when people are hit with cancer, what's going to happen and what their feeling is. But the big thing is for us to be aware, us to be educated about it. The more educated we are, the less fearful we are. Fear is a lot of times what can lead to depression. And we know there's a large amount of other things that happen when people are depressed. On the phone, we have an expert, Dr. Grunberger. How you doing, sir?
I'm doing very well. Nice to speak with you.
Hey, Doc, I know you're busy, and prostate cancer is a big thing in the Black community. It's something that we talk about a whole lot, something that people push information on radio. But we want to begin talking about some solutions, some things about preventive. But tell us first, why is it that African-American men get this so readily, more so than anybody else?
Well, it does appear that there are some genetic factors. That's probably the most important fact, is that genetically there are differences. And so the African-American men do have, just based on genetics, roughly about 1.5, 1.6 times greater likelihood of developing prostate cancer than do Caucasians or Asian Americans. So that's probably the most important factor.
Why? What caused our genes to be able to have that? What caused that?
That's a good question, but it's something that's happened probably over millions of years, just in the human genetic development. So that I cannot answer.
So tell us, what is prostate cancer? What is it?
So prostate cancer basically is a cancerous abnormal growth of the tissues within the prostate gland. The prostate gland is the gland that surrounds the urethra, the tube that we urinate through, and its function in the body is to produce semen. So it's important in terms of procreation, but it's not doesn't have a vital function for life. When that grows, you have this atypical growth of these malignant cells, they eventually can become a large tumor and potentially can, if untreated, can metastasize or move to the rest of the body, and that's obvious situation that could be very dire.
What causes that? What causes it to occlude? And so we're talking about something that's around the urethra. If it gets big enough, it closes it off?
Well, that can happen, but we see that more with even a benign enlargement of the prostate. So the cancer, prostate cancer, doesn't necessarily have. That's not necessarily the main problem that we worry about, because we can have a cancerous growth even in a smaller prostate that doesn't necessarily cause occlusion of the urethra. It's more what we worry about is that, like other cancers, if it starts spreading to other parts of the body, then it can really affect the whole system, and it can kill people. We always were told that prostate cancer is a cancer people die with and not of, but that's not necessarily the case. There are definitely different types of prostate cancer in terms of how aggressive they are, but we know that there are definitely aggressive forms of prostate cancer that can kill.
What makes it grow? What gives it the cancer? Why does the cancer happen in the first place?
Well, again, it's something that's probably predisposed genetically, that some cells just start multiplying, out of whack and just multiply very fast and develop this tumor growth. And again, there's some in the low grade type of prostate cancer happens very slowly. It may have bad effect to the patient. But in the higher grade cancers, where the cells start growing out of control, it can happen quite fast. So our job as urologists, which is who especially deals with this, is to obviously first to try to identify these cancers very early so we can control them, because this is definitely a very controllable disease. And then once we identify it, to try to figure out which ones are the ones that will likely progress and can cause serious effects of death versus the ones that may act in a kind of benign fashion and we can just watch.
Do you know what media received the first Eagle Award by the Jacksonville Sheriff's Office for being the most factual? The Florida Star. Do you know which media solely addresses issues of concern for African Americans? The Florida Star. Do you know which media carries local, state, national, and international news regarding African Americans? The Florida Star. Do you know the only media that carries a special section for our youth at home? And the schedule for 3 black television networks. Now you know the Florida Star. Northeast Florida's largest, oldest, and most read African American newspaper, serving since 1951 in more than 200 locations. The Florida Star. News you can use. News you can trust. The people's choice. Striving to make a difference. Subscribe today. Call 766-8834. That's 766-8834. Pick up the Florida Star at over 200 locations. Or to have it delivered, call 766-8834. The Florida Star. Speaking truth to power.
I couldn't imagine when someone loses sexual function, say a man loses sexual function and he's married, is there some kind of counseling that goes along with that? Because my goodness, I couldn't imagine that.
Yes, I mean, look, we always counsel patients and we discuss these before any treatment, because all of the prostate cancer treatments, including surgery, radiation, and so on, can affect the erections. But the way we counsel patients is number one is that the most important thing is to get rid of the cancer, of course. Number two is that we have treatment for erectile dysfunction if that happens after the treatment, including medications, injections, even penile implants, so that men who want to be sexually active can be. But now some of these new procedures that we alluded to before, we can treat patients earlier and not treat the entire gland necessarily, and that also helps to protect the sexual function.
Okay, so we have somebody with prostate or don't know they have prostate cancer. How soon should they begin getting checked, particularly if you're African American? How often should they get checked? And tell us what the scenario is when they walk into a doctor's office, they're alone with the doctor. Describe that check.
Okay, so basically, when I see a man who is over 40, because we really do recommend that African American men start checking at the age of 40. That visit involves basic general patient's medical history, and it's focusing on the urinary function, sexual function. And then in terms of specific prostate cancer check, there are basically 2 things. One of them is a blood test. It was called PSA, which became quite controversial, which unfortunately, a few years ago, a government-sponsored commission decided that this was not a good test and it sat against working skin. Unfortunately, that's kind of been reversed. And I think that was that created a lot of potential problems and was not a great recommendation. But that's a simple blood test which checks something called PSA, prostate-specific antigen, which is not a perfect test, but it does give us an indication something may be going on with the prostate. So that's the one test. The second test is a digital rectal exam, where basically with a finger and the rectum, we check we see the prostate, and check for the size of the prostate, any sort of abnormality on the bumps or bumps-based symmetry and so on. Unfortunately, obviously that's not pleasant for most men, especially the idea of it. And culturally, and I practice in an area that's a very high African American number of men. It's a lot of men are really not happy about having this test done, and that shouldn't be so, because it's potentially very informative test, and it's not painful, and it takes about 15 seconds.
I'm gonna tell you, Doc. I did after my first prostate check. I'm telling you, I went into the office. And this is a black doctor. I was at Howard University Hospital, and I was talking to the doctor, and we were having a good conversation. He said, "Okay, now it's time for me to do the physical." I was doing a whole physical. I got down to the prostate one, and so I did the prostate exam. The conversation I had with him before the prostate exam and how I felt, and after it and how I felt, was like, whoa. I was ready to get out of there. And to this day, I always have a female doctor. I never have a male doctor when I get a prostate check now. I'm telling you, it so freaked me out, and, hey, say what you want to say, but now I got female doctors. Have you seen things like that, or see African Americans kind of uncomfortable about getting that rectal exam?
I think what I find is actually that a lot of the men, my patients, I kind of feel weird about going to a female doctor for that test, but it's an individual thing. I think that what I try to tell patients, look, I'm at the age group that I have to be checked once a year, and I do get checked once a year. I don't enjoy that rectal exam either, but I understand how important it is. So to have it done once a year, which is basically the recommendation, to have the blood test and the rectal exam once a year, it's 15 seconds of unpleasant treatment once a year. I think to me that's worth it to have the peace of mind that nothing's going on.
You're right. Okay, so what do you feel? So you got the gloves on, you go in. What do you feel to say, hey, this guy has an issue?
So we feel that, first of all, check the size of the prostate to see if it's enlarged. That in itself is not, we know that as we grow, every man's prostate enlarges. That's normal. So, but we do check the size of it, and we check the symmetry to see if the left side versus the right side, if there's a discrepancy, that may mean that something may be going on. And most importantly, we feel sort of for the texture of the prostate. The prostate normally should be sort of firm and smooth. If it's irregular, if there's a hard bump, that tells us again that something may be going on.
Okay, so there is a new situation going on that I think that black men and others as well should know about in this field. What is HIFU? What is that?
So HIFU stands for high intensity focused ultrasound, and it's a very exciting technique. I've been actually involved with this for many years. I've been involved in the initial studies back in the late 90s. And it's something that's finally been approved by FDA the last years, if you know, in this country. And what it does is we think of ultrasound as something that we go for to check for during pregnancy or to look at the kidney stones and so on, just the imaging study, which gives us a picture. But that's a low-intensity ultrasound. But high-intensity ultrasound is an ultrasound wave that can actually create heat away from the source at a very specific focus.
So you're saying high intensity focus ultrasound.
Correct.
Right.
Correct.
Okay.
So the way this works for the prostate is that there is a probe that goes into the rectum. Now this is done with anesthesia so that the man doesn't really feel this. And within this probe, we have a standard imaging ultrasound, which gives us pictures so we can look at the prostate. And it also has this high-intensity ultrasound. So basically, the way it works is that the probe goes into the rectum, we image the prostate, we know where the prostate cancer is from previous biopsies that were done, MRIs, and so on, and we can target specifically the area that has the cancer. And this is really for men who have early cancer that's very localized to one part of the prostate. And I mean, this procedure can be done for the entire prostate, just like surgery and radiation. But I think the beauty of this procedure is that we can avoid treating the entire prostate if we know that we're just doing one specific area. And as such, the results have been very good, but we can avoid the potential complications of the other procedure because we're not treating the whole prostate. So in the issues with urination are negligible, and we can also preserve the erections in much greater number of men than the other procedures. And it's a procedure that's completely non-invasive because basically the probe is in the rectum, it shoots these focused ultrasound beams and we're into the prostate. It doesn't affect the rectum itself, and there's no incisions, there's no cuts at all, and it's an outpatient procedure. The patient goes home afterwards. Doesn't have to stay in the hospital.
But this is mainly based on if it's caught early.
Correct.
So does all the doctors know about high-intensity focused ultrasound, or should the person go in and say, hey, if they find anything, hey, doc, do you know about high-intensity focused ultrasound, which is the new treatment and technique?
I think at this point, if the patient is informed about it, he should speak to the doctor about it and mention it and make sure they know, because even in the medical community, this is not something that all the doctors are aware of at this point. Or they might have heard of it, but because it's been approved fairly recently, they may not be very much aware of all the details of it, and as such may not be recommended. So I think right now our job in what I'm doing too is I'm educating other physicians and urologists about this procedure, and I also help to train other urologists to do this, because I think that something that we should definitely have as part of our armamentarium, as part of one of the things that we recommend to the patients.
This is Opio. I'm speaking to Dr. Grunberger. Hey, Doc, tell us a little bit about who you are, your history, and where you went to school, your teaching. Tell us all about this good stuff.
So I'm in the New York area. I was educated in New York. Went to college at Columbia University. Went to medical school at New York University, and I then, when I finished, and I did my training there as well in urology. And after I finished, I moved all the way from Manhattan to Brooklyn, and I've been in Brooklyn ever since. I've been involved with teaching at State University in New York and downstate, and now with Cornell University. And I've been practicing urology for 30 years plus, a little bit, and involved in doing a lot of clinical research in both benign and malignant diseases. And I really enjoy doing the research. I enjoy teaching residents, the young doctors, and working always with new technologies and less invasive ones where we can help patients, treat patients with less invasive fashion, less side effects. That's what excites me.
That's awesome. Let me give you the final words, Doc, before I let you go. Let the people know something that we probably did not discuss here, or maybe some encouraging words, or something to black men to make sure they get out there and get checked.
I think, again, I think we have to get over the stigma of having this test done. It's really, 15 seconds of unpleasantly, but it can save your life. The African American men are in the highest risk group, and especially if you have family members that have been affected with the disease, that makes your risk even higher. But you can avoid the really you're over 40, go see your doctor once a year, get the blood test, get the rectal examination, and try to really, and for other reasons too, we really all should be doing a little bit better in this country in controlling our fat intake, and controlling obesity, because that can only promote growth of prostate cancer. It can promote other diseases, as you know. But this is a disease that is the number one cancer in America. 200,000 women get diagnosed every year, but it really is curable, and you don't have to necessarily go through very aggressive treatment to be cured if you catch it early. So go and see your doctor, and there's no reason to have to go to the depression that unfortunately the gentleman went through that you met.
Yeah, I had a friend named Damu Smith that died from this. Man, it was sudden, and it was so incredible, so horrible. Dr. Grunberger, thank you so much for all the information, and we know how important this is, and thank you for the encouragement to tell those people, hey, you got to get out there and get checked early, because you got family members that love you, and they want you to be well, and they don't want you to suffer until you die. They want you to get everything checked early so you can continue on to see your babies and grandbabies and maybe even great-great-grandbabies. Dr. Grunberger, thank you, sir.
It's my pleasure. Happy New Year, everyone. Bye-bye.
All right, I hope you enjoyed that really informative interview and information on prostate cancer. Got to get out of here. Make sure you continue to pick up a copy of the Florida Star newspaper on newsstands every Friday and Saturdays, as well as Star TV 18.2, the best programming in all of Jacksonville. This is Opio Speaks. I got to get out of here. We will see you next time on Impact.